and welcome to the Observational Checklist Introductory video. We will be referring to the Observational Checklist as the OCL. The main objectives of the OCL Introductory video are to introduce the OCL and electronic data collection, as well as develop an understanding of the importance of collecting this data. So what is the OCL? It is an observational analysis on the quality of care delivered. In addition, it helps to ensure that nurses are providing high-quality care throughout the entire health assessment process, and it is a tool to help achieve and maintain the Ministry of Health standards for maternal and child health. The OCL process will consist of two main partners. These are the Ihangane Project team and nurses at the local clinics. The Ihangane Project will be responsible for collaborating with the 7 health centers in the catchment area of Ruli. They will also assist in the ongoing OCL training process to ensure that the data collection and reporting process is being completed accurately. The data collected will be evaluated every 4 months. Staff members from TIP will then hold meetings to discuss the results and strategies for continuous improvement. The OCL is so important because it will aid the health centers in meeting the standards set by the Rwandan Ministry of Health. Through utilizing the OCL, we can strive towards long-term sustainability and improving the health outcomes for mothers and children. Data collection is the most important component of the OCL. This is the process of gathering and measuring information on variables of interest in an established and systemic fashion. When collecting data for the OCL, we will want to make sure that we are maintaining data integrity. This means making sure that the data collected and reported on is accurate and complete. When collecting data, it is essential to take precautions to ensure that the data recorded reflects what actually occurred. This may involve calibrating your instrument and recording the precision of the data collected or the scale of measurement. It can also be helpful to take multiple measurements and ensure that you are using standardized methods for data collection. Now let's take a few seconds to pause the video so that we can briefly discuss the following questions with a partner. Where in the data collection process do you believe you succeed? And what can you improve upon to make your data collection more accurate? Welcome back! Remember that learning how to efficiently and effectively collect data is a process. Nobody is going to be perfect at first, and we are all learning how to accurately collect data together. Lastly, don't be afraid to ask questions. The observational checklist will consist of 5 skill sets of focus. These include clinical practice, mom-centered care, logistics, education, and data management. The clinical practice component of the OCL will consist of the following: correct measurements of vital signs, the correct assessment for physical signs of malnutrition, including height, weight, and middle upper arm circumference, the appropriate assessment of clinical findings, including Z-scores, and lastly, HIV testing. The mom-centered care indicator for the OCL will assess results from the new patient interview, mid-program review, and exit interview. In addition, the compassionate care delivered by the nurses will be assessed. The education component of the OCL will assess the water and Sosoma preparation training. In addition, it will evaluate how confident and knowledgeable nurses are on health education topics and assess the mother's level of understanding of these health topics. The data management portion of the OCL will include assessing whether or not all OCL data points collected are appropriately documented and ensuring that monthly clinical and stock reports are completed correctly. The last OCL indicator, logistics, will include assessing whether or not monthly assessments are run efficiently and in a timely manner. This indicator will also investigate if malnutrition referrals and SOSOMA distribution are being completed appropriately. Every 4 months, health clinics will meet with the Ihangane Project to discuss the OCL results. Changes will then be made for quality improvement based off of these reported findings. The Ihangane Project is working hard to transfer data reporting to an electronic format. This change will consist of a mobile application that can be used on tablets. The app will include the OCL, which will enable nurses to report results to the Ihangane Project electronically. The second component is the online server. This is called Kobo Toolbox. This resource will help TIP and other stakeholders to analyze the data. In efforts to make the transition to electronic data reporting as smooth as possible, the Ihangane Project has designed an OCL app user manual. This is an excellent resource for health centers to utilize when making this shift. Electronic data reporting has many advantages. A few key benefits electronic data entry has over paper are that no storage space is required, electronic forms are safer and less likely to be lost or damaged, and data visibility leads to improved management and quality. Here are a few tips to keep in mind when learning the electronic data entry process. Don't forget to double check and investigate out-of-range values or outliers. It is also important to check for data completeness and to verify random samples of your digital data versus the original data. You may also want to have another collaborator co-enter the data and peer review to make sure you don't make any mistakes. All right, we now have a few questions for you. True or false? The information from the OCLs won't be used for anything. Feel free to pause the video and discuss your answer. All right, the answer is false. The information and results from the OCL will be vital to the continuous quality improvement process. True or false? It is important to standardize clinical measurement techniques. Feel free to take a few minutes to pause the video and discuss your answer. Okay, the answer is true. Standardizing measurement techniques is an important strategy for collecting accurate data. The PDSA model, which stands for Plan, Do, Study, Act, is helpful when looking at the OCL process. During the Do component, we will be implementing the plan for OCL data collection and reporting. Next, we will study and observe the results from the OCL. This will include analyzing the data and comparing results to predictions. In the Act phase, we will take action on what was learned by making changes and modifications for improvement. Next, we will plan for the next OCL data collection cycle by setting objectives and predictions. Overall, the PDSA cycle is an important model to reference when implementing the OCL for continuous quality improvement. Thank you for watching this video. We wish you the best of luck with the OCLs.